Okay. I am wearing my BSI. My general impression is a 22-year-old male who has fallen off a ladder inside his home. Patient looks unresponsive. There are no bystanders. There's only one patient. The weather is fine for transport. The scene is safe. There are no weapons out. There's only one patient. Sir, are you okay? Are you okay? Patient is unresponsive to verbal stimuli, stabilizing C-spine. At this point, I'd have a partner who would maintain stabilization of C-spine, but because it's just me, I'm going to keep going at this point. Sir, are you okay? Patient is still unresponsive to verbal stimuli, trying painful stimulus. Patient is groaning. Sir, can you hear me? Patient is groaning, so not quite unresponsive, but not alert and oriented either. I'm going to check his airway. The airway is clear. There are no loose dentures or fittings that could block the airway, and the patient's tongue is not in the way. At this point, if the airway was compromised, I would find it and fix it by inserting an oropharyngeal or nasopharyngeal airway at this point in time. I'm going to check the patient's breathing. Hands are rising equally on the seams, both sides. Breaths are clear, steady, and equal on both sides with a rate of with a rate of 12 breaths per minute. Checking carotid and distal pulses. Pulses are strong, regular. With a rate of 60 beats per minute. The capillary refill time is less than 2 seconds. The patient's skin is warm, pink, and dry. Checking the patient's pupils. Patient's pupils are round, equal, and reactive to light. This patient, due to his unresponsive nature, is going to be transported as a high priority patient. At this point, I would direct my partner to get a long board and a cervical collar to apply to this patient. And for right now, I will do a rapid physical exam. I am checking the head, mouth, chin, neck for any deformities, contusions, abrasions, swelling, lacerations, or penetrations at this time. Please note that my video subject would prefer that I do not expose his chest or his legs, so I would have done that at this point, but will not for the purposes of this video. Checking clavicle, scapula, and the back of the neck for there are no stuff-offs. There are no tracheal deviations or signs of JVD. Patient makes no signs, small signs of pain when palpating the abdomen. Checking the hips. Hips appear good. And the legs. Sir, can you feel me touching you?
Mm-hmm.
Dorsal patellis pulse is strong and regular. Babinski reflex intact. Sir, can you feel my hands touching your feet?
Mm-hmm.
Can you push down on my hand? Pull up. Okay, good. I'm going to check your other leg. Can you feel me touching this leg?
Mm-hmm.
Pulse on this side is fine as well. Okay, Babinski reflex intact. Sir, can you push down on my hand? Pull up. Okay, let's take a look at your arms. All right, can you feel my hands touching you? Can you squeeze my hand? Okay, good. Can you push down on it? Pull up. Good. Can you feel my hand touching you on this side? Can you squeeze my hand? Good. Push down on it. Pull up. Okay, good. Alrighty. I'm going to check your back now, and I'm going to roll you to do that. At this point, we will also insert a longboard under your back. Okay. Alright, there are no signs of bleeding or contusion on the back. At this point, we'd be rolling down onto the longboard here. Okay. And now I will check again, checking the forehead. Everything looks good. Ears look good. Good. Okay. Neck still looks good. Scapulas are good. The back of the neck is fine. Chest is good. Still uncomfortable when I press here? Okay. What about here? No, nothing? Can you still feel my hands? Push down on my foot or push up on my hand? Okay. Okay. Push down, pull up. Okay. Squeeze my hand. Push down on it. Squeeze my hand. Push up on it. Okay, I'm going to take your blood pressure. Blood pressure is 120/90. And I'm going to listen to your chest again. Okay. Pulse is strong and regular, and breath sounds are clear and equal on both sides. Checking your capillary refill. It's still less than 2 seconds. So at this point in the ambulance, we would get you on a 12-lead cardiac monitor, and we would get your blood sugar. We don't need to call ALS, but we will reassess your vital signs every 5 minutes on the way to the hospital. Okay.